This is an abnormal opening in the ventricular septum which allows oxygenated blood from the left ventricle to mix with the deoxygenated blood in the right ventricle. And the right ventricle receives blood from the right atrium as well as from the left ventricle, leading to a volume overload and pulmonary congestion. In fact, the VSDs are the most commonly occurring types of congenital heart disease. Okay, so even more than ASDs. Okay, but in ASDs, if you all will remember, ostium secundum is the most common type of ASD. Yeah, so the percentage wise, VSD is like 14 to 17%, not too much more than ASDs, but certainly slightly more, definitely. So what are the different types of VSDs?
Perimembranous, muscular, inlet, outlet.
Wonderful, wonderful. Very, very happy to hear that. So as you can see, try to remember these diagrams. It will, if you remember these diagrams, no, you will never need to recall anything theoretical and all. Try to think of those ventricle, what could be the possible positions. So one is a supracrystal. Supracrystal, what will happen is it is just below the aortic valve, okay, at the LV outflow tract. Then is the membranous VSD. Membranous VSD is the one which is just inferior to the crista supraventricularis. Yeah. And the last one is muscular VSD. So, of course, so it will be in the mid to apical interventricular septum. And being clinicians, we are interested, how about the signs and symptoms? Sorry. So the signs and symptoms, they tend to change with the size of the defect. And the clinical symptoms are usually not seen at the birth. However, because of the continued high pulmonary vascular resistance in the newborn, the infants with moderate to large defects will become symptomatic within the first few weeks itself. So there will be shortness of breath, poor growth, failure to gain weight, pounding heart, even frequent respiratory tract infections as well. And yes, if there will be shunting, so for example, the impure blood goes to the other side, patient will develop cyanosis, clubbing, and also the distress as well. So, okay, so this is the history which we will come across. So how do you diagnose? So the patient comes to you, okay? And as I said it, I'll try to give you memory clues always of the VSD. So you have a phonocardiogram. So what type of murmur will you hear? So on auscultation, you hear is a pansystolic murmur. Okay? Where the S1 is masked by the murmur and the S3 can be heard at the apex. Right? And what do you see in the chest X-ray? So what do you notice in this? I have already given you all the hint as well.
Cardiology is present, but on the mark I can't see exactly clearly.
And what else?
Water. Can see cardiomegaly. Rest I don't understand.
Okay, okay, okay. And what else?
What else
So of
on
course, what about the pulmonary vascular markings? Don't you think they are more prominent? The patient is going to need some diuresis as well. So good thing is cardiomegaly, definitely the RA is definitely enlarged and the RV is also enlarged, and there is prominent pulmonary vascular markings. So now coming towards the management. So the patient has come to you. How will you manage? So what are the drugs? As I already gave you a hint. So those patients may need is a digoxin, diuretics, nutrition you have to take care. You also have to give them high calorie formula, even the breast milk. And if you can supplement the tube feedings as well. And yes, those patients may need sometimes prophylactic antibiotics to prevent bacterial endocarditis as well. And sometimes, as I said, it once they start to grow up as well, and still the problem persists, then for such patients, we may have to consider for the surgical repair using those stitches or the patch, which I said it. And nowadays, we also tend to use septal occluders as well with the surgery. Although yes, there's a very good success rate, in fact, and the growth also catches up very well. In fact, although even if you have done the surgery up to 2 to 3 months post-operative as well, still you may be able to hear the murmur. You may be, as I said it. So post-operative within 2 to 3 months, it's not much of importance, I would say. Okay, so that is one of the really important things. As I said, it